So I'm at the fourth student learning outcome, which dealt with collaboration with the healthcare team by creating a care plan for a patient that had pneumonia. And in the care plan, I had to utilize information from respiratory and speak to the respiratory therapist, medications prescribed by the doctor, the x-ray, and the techs that took them, and the doctor that read the x-ray to confirm pneumonia, as well as PT and OT to ensure that the patient was getting up and out of bed so they could heal from pneumonia and they weren't getting any pressure ulcers. And so while looking at that, all of Newman's lines of defense were assessed because the patient needs to take antibiotics to prevent further infection because their flexible line of defense had been broken. And also I did a care plan in peds, which I encompassed a total prep and all the labs drawn, the doctor's diagnosis, any other therapies involved. So I needed to speak to physical therapy to help the child get out of bed with their disease. And I also included my 335 reflection video in which I covered talking about shadowing a dietitian, which was very helpful because diet is a huge part of maintaining your health. And so if you can't maintain a good diet that has all the substances you need, your flexible line of defense will break down and you're more likely to get sick, especially if you're not getting certain vitamins or proteins. And so being able to follow a dietitian, I now as a nurse will have a better idea of what they look at for patients and how they assess the dietary needs of the patients that they see. I also followed a nurse manager for a unit at Good Shepherd Rehab, and I was able to see how her role changed now as a manager versus a nurse. And so she definitely has more of a administrative role and less direct inpatient care. And so I see what the administrative end of nursing looks like and all the charting we need to do and why it needs to be done. I was able to see from that perspective. And so I also was able to speak with some doctors during a lot of my shadowing experiences because the doctors meet with the dietitians to discuss different things than they would with the nurses. And so I'll be able to pull in what the doctors and dietitians spoke about into my own personal nursing care in the future.